I shortened the title a little bit just to keep on schedule. So we'll start right away. It's about Celecoxib and a polyesteramide drug delivery system in osteoarthritis. So osteoarthritis is a serious disease. I don't have to explain that to you here. It's the most common joint disease worldwide. The incidence rises with age, as you can see in this graph over here. The cause is multifactorial, and it doesn't even increase with age, but also over time. You can see the latest years and the future years, it will keep on rising. And to date, we don't have an effective treatment yet. We use oral medication like Panadol, paracetamol. We have Voltaren gel. We have a lot of infiltrations, which we heard about just now. Corticosteroids, hyaluronic acid. And in the end, all what's left is the total knee arthroplasty. So what are the disadvantages of oral medication? They have a low local bioavailability. You won't have the drugs in the joint. And because of that, you have a lot of systemic side effects. And intra-articular injections, they provide an effective local concentration and minimize the systemic side effects because of that. But is this effect, is it sustained? In this study by Evans, you can see that it's easy, or we can get the drugs into the joint, but it fairly quickly goes out of the joint again. So for lidocaine, the half-time is 1.5 hours. For triamcinolone, it remains 1 to 3 weeks in the knee. Hyaluronic acid or Synvisc remains a bit longer, 1 to 2 months. But diclofenac and NSAID, only 5.2 hours. So it's very short. And what you get is this kinetic of a free drug. So you again get here and here again, you get a toxic range. And after that, the therapeutic window isn't, you don't get into the therapeutic window. And with a drug delivery system, you get there and you stay there. So that's why we went to that. So what are the risks of intra-articular therapy? You get the steroid flare in about 2% of patients, and we have the risk of a septic arthritis. It's a small risk, but the more often we do an injection in the knee or in other joints, the risk, of course, increases. And in the end, we often still have to do the total arthroplasty. There is an increased risk, is described. So when you do an injection with a drug only, you still have frequent injections, often a toxic concentration, and many drugs are broken down in the joint. When you provide this drug in a drug delivery system, you can provide a single injection, so of course you have a better patient compliance. In the end, it might be cheaper as well. You have a stable concentration, and the drug is protected from breakdown. But that's not all, because if you have a drug delivery system which can provide a controlled release, then it can remain even longer, and I'll show you that later on. It only is provided with active disease. So we use Celecoxib for that. It's a COX-2 inhibitor, and it's an effective oral painkiller in osteoarthritis, and it inhibits the COX-2 prostaglandin formation. Our microsphere that we use is made of polyesteramide, and in active disease, the proteolytic enzymes in osteoarthritis, they cut down the polyesteramide into amino acids, diols, and diacids, which are no harm to the joint. So DSM Biomedical made these microspheres for us, and it's an oil and water emulsification process, which you can see schematic figure of that over here, and an electron microscopy of the microspheres, which you can see the size is in between the 10 and 20 micrometer range. So the aim of our study, we formulated 4 questions. So is indeed Celecoxib released from the microspheres? Are the polyesteramide-based microspheres biocompatible in an OA knee? Do they degrade in vivo? And is there a disease-modifying effect in vivo of our combination drugs? So the setup we used is male Lewis rats, and we transected the anterior cruciate ligament and did a partial medial meniscectomy. In 4 weeks, you get a moderate osteoarthritis in the knee, and then we injected the knees, the operated knees as well as healthy knees with normal saline, microspheres without Celecoxib, microspheres with Celecoxib, and Celecoxib alone without a microsphere. After 3 and 12 weeks, we sacrificed the rats, and we looked at the results. So what were our outcome measurements? Indeed, is Celecoxib released? We looked by chromatography and mass spectrometry, and we looked at prostaglandin E2 levels in the knee homogenates. The biocompatibility we assessed by a histologic score of the injected knees, and degradation we looked at the amount of PEA in the hydrolysates of the knees, again with mass spectrometry. And OA modification, so disease modification, was checked by ORC score on the histologic slides of the rat knees. So in vitro, you can directly measure the Celecoxib release from the microspheres, and we can see initial burst release and then a gradual release of Celecoxib over time. And in the knee homogenates, we were not able to measure directly, but by measuring prostaglandin E2, and you see a diminished prostaglandin E2 levels in the loaded microspheres. So we conclude that there is indeed a release of Celecoxib. They are biocompatible. So in these slides of the rat knee, you can here see a synovial fold with no thickening, no necrosis. We saw a single giant cell and macrophages, which is normal foreign body reaction. The cartilage was not damaged. So here you see some slides of the healthy knees, and with the different groups that were injected, and the cartilage all looks fine in every single knee. So no damage is done by the injection itself. Unfortunately, I don't know if we should have expected it, we didn't see any disease-modifying effects in 12 weeks. The different groups show all the same amount of osteoarthritis. So therefore we conclude that the microspheres are biocompatible, they degrade in vivo, they degrade quicker in an osteoarthritic knee, and Celecoxib inhibits that degradation. So we don't see a disease-modifying effect, but we know that the microsphere has a big opportunity to work on further. And I hereby like to thank my colleagues for joining me in this project, especially DSM Biomedical for joining us in this project. And later on, Laura Kramers will continue on my story to provide you even more success of these microspheres. Thank you.